I'm going to start by showing some general navigation and how to get started using the system of Digital Physician. I've logged in to a test account, so everything here is fictitious. All the names are created. And in this case, I'm logged in as a nurse, as indicated down here at the bottom right. So when you first log in, you'll come to the inbox, and this is where you'll see any messages that you've received from other staff members. Sometimes there also may be system generated messages like tasks that need to be completed. The next tab is the calendar, which will show appointments that have been created. This is a new system test account, so there's not very many appointments here, sorry. You are able to narrow down by the staff member. And of course, if you click on the date, it'll take you to that day. There also is a calendar which is separate from the patients. It's simply for hospice events. In here, you can enter in anything from out of office, holidays, who's on call, answering the phones, etc. The next tab along the top is the census, where you'd have your patients that are currently active and being cared for. On the far left, I'm using an iPad in this case, so it's hiding some information that you would see on the desktop, but to reveal it, you click on that little button on the left and it lets you filter the patients. So if you want to see who's receiving home health aid, you can do that. Or you want to see the case manager, if there's more than one case manager, it'd be listed here. Who's getting spiritual care, so you get the idea. When you click on a patient's name or that row, it'll take you to their chart. And we'll come back to the chart in a little bit. The next tab from the main screen is encounters. And these are all visits that have been scheduled for you that are outstanding or need to be completed. It'll only show visits that include today or that have passed. It won't show future visits, but as soon as the day of the appointment comes, it'll show up here. And you simply just click on the row that you want to work on. And then the next tab shows reports. Not all users will have access to these reports. It's up to the administrator to specify who can view them. A useful report is missed appointments. The final tab here is uploads. This system is a hybrid system, so it allows you to scan or take a picture of a paper and upload it to the system. For example, a pulsed form, physician orders for life-sustaining treatment. So this is where it would show up, and then you'd route it to the person's chart. And then over here on the far right is the gear icon for settings. So there's three things here I'll show quickly. The notification settings, which you'll probably want to set up. It lets you receive either an email or if you want a text message whenever a new message shows up in your inbox. So you just put in your phone number here and save it. It does not transmit any private health information, or protected health information. It'll just tell you that there's a new message waiting for you in the inbox and a link to connect. The other settings is system preferences. You can specify how long before it'll log you off if you're idle. It has some auto suggest words and of course how to change your password. And then user details in case you have to update your name or email or phone number. If you do change this email, it will affect your login. Your email is your login username. And then there's a link for help, which will show more tutorials. And then I want to point out some things at the bottom. These buttons here, this locks the screen. This will refresh the screen if you're looking at information. You just tap on that or refresh it. The plus button allows you to add actions, so you could add a patient, admit the patient, create a message, start a video call, or schedule a visit. This button here is just a simple chat system with other online users. And then this rewind button will show the charts that you've opened up recently and takes you right back to them, which is useful. And it works across systems. So your phone, your iPad, your desktop, it'll have the same history. So here's a patient's chart, for example. You can have pictures, shows their home address with a link to a map. It shows encounters or visits that have been made, which you can view by clicking on it. The other tabs along the top, you have the plan of care, which is important for hospice. Treatments, which shows the medications and equipment. Monitoring, over time, it'll show you vital signs and other information that's captured from the notes. And then chart contents would be those items that were scanned in for you to view. And then down here at the bottom, notice the green button. This lets you bookmark items or make personal notes. So these are only available to you. It's not necessarily part of the patient's chart. So for example, I put in here granddaughter's friends with my niece. So it's just little personal notes you can put in. And then under the actions button next to that, you can add a new contact. You can put an order in for a medication. You can add a result, upload a file, start a visit encounter, staff message, update demographics. And then down at the bottom right, you can print the chart. You can specify what you want to print. And then it creates a PDF that you can print. And you could do a similar thing, faxing it. You can show a list of all medications. And of course, since the new law went into effect, you can print out the notice of non-covered items for the individual, for your Medicare patients. So that's a quick introduction how to get around the system. There'll be more tutorials with specific details.